Ghana, country of Western Africa, situated on the coast of the Gulf of Guinea. Although relatively small in area and population, Ghana is one of the leading countries of Africa, partly because of its considerable natural wealth, and partly because it was the first black African country south of the Sahara to achieve independence from colonial rule. Teenage pregnancy is when a girl aged 13 to 19 becomes pregnant. Teenage pregnancies are linked to disadvantaged social and economic situations. This phenomenon is regarded as a serious public health issue worldwide. In low and middle income countries, about 21 million teenage girls aged 15 to 19 years are estimated to get pregnant, and about 16 million give birth annually. Globally, teenage pregnancy is expected to increase by 2030, with high concentrations in sub-Saharan Africa. Already, the highest teenage pregnancy rates are recorded in Africa. Records show high prevalence across the sub-Saharan African regions: 16.3% in Eastern, 27.9% in Western, and 28.9% in Southern Africa. Ghana, from the western side, reports that about 14% of teenage girls aged between 15 and 19 years have started childbearing, with about 11% live birth rate from the Ghana Statistical Service 2014. Teenage pregnancy is associated with a high risk of maternal and neonatal complications. Teenage mothers are at risk of complications including hypertensive pregnancy disorders, unsafe abortion, urinary tract infections, and premature rupture of the fetal membranes. Others include high risk of poor nutrition, anemia, sexually transmitted diseases, and a high rate of instrument delivery. Complications arising from pregnancy and childbirth are indicated to be the #1 cause of death among teenage girls worldwide from the World Health Organization 2016. Numerous factors documented to be major contributors to teenage pregnancies include societal and traditional norms such as early marriage, childbearing as a measure of maturity, and a means to elicit societal respect, sexual abuse and living in violent communities, lower level of education, and influence or pressure from peers. Others elaborated include teenage sexual behavior such as unprotected sex and or lack of use of contraceptives, early sexual debut, and frequent sexual intercourse. Furthermore, family-related factors such as divorce and non-intact family structure, history of maternal and sibling teenage pregnancy, and poor family economic status have all been noted. Between 2012 and 2014, 5 regions recorded the highest teenage pregnancy rate of more than 14% from the Ghana Statistical Service 2014. In the Sunyani municipality, the recent rate of teenage pregnancy was 8.3% recorded in 2017 as one of the highest rates in Ghana. It is therefore important that key local risk factors associated with these public health problems are established. Adequate knowledge and understanding of these factors could help inform the most appropriate and effective interventions. The findings from this study in the municipality provide the contextual evidence, as expected in a case study, to draw the attention of authorities and all stakeholders towards solution development.